Hi, Dr. Kevin Windisch from Sparks Pediatric and Adolescent Medicine here. And this is our Facebook page below, and if you need to get a hold of us, our phone number. Please, or welcome to our video series for students. And let me apologize for the tremendous delay in getting this video done and up. Things have just been kind of crazy in the office for the last couple months, and so I know I haven't been around like I like to be. But please check us out on Facebook. Check out the rest of our videos on this channel. Please subscribe to our video series and send us a like if you find this useful. Today, what we want to talk about are some basic statistics for biostatistics. And I know these basic statistics drive students nuts sometimes, so I'm going to draw what you've seen a million times, but we're going to see if we can't explain it in a way that maybe other people haven't been able to quite help it make sense for you. So we're looking at patients with disease versus no disease on this axis coming across the top, and then going across the y-axis we have patients with a given test who test positive versus negative. Okay, these are your true positives. These are your false negatives. These are your false positives. And these are your true negatives. So let's look at the four statistics. Sensitivity of a test. And this is the statistic that people kind of glom onto the most, and for many medical providers I think is the only statistic they understand. So what is sensitivity? Well, it is the true positives divided by the true positives plus the false negatives. So divided by this number right here. Okay, or to get away from mathematical symbols, divided by this number. Okay, what this really represents, and I think this is if I teach you anything about these statistics, I want you to understand what it represents. And this is the percent of people with a disease who will test positive. So for example, if I am screening or testing for streptococcus, strep throat, what percentage of people, this is a P here, not an E by the way, what percentage of people who have strep throat will test positive with my new assay? And that's a valuable number. Okay. The next thing we want is the specificity. And the specificity is going to be the number of true negatives divided by this number. Well, my box isn't a good box, but you get the idea. True negative plus false positive. All right, or if you want to use mathematical symbols, It's the number of true negatives divided by this number. Put another way, it's going vertical in the columns in both cases. Sensitivity and specificity go up and down. Okay, this is the percentage, and again, more important is the definition. The percentage of people without the disease who test negative. Now, these are somewhat erroneously referred to sometimes as your false positive and false negative rate. And this is kind of what I want you to understand. It's not necessarily the case. And there are some better statistics at looking at this. Okay, so the next statistic we want to look at is your positive predictive value, or PPV. Whoop. Here we go. We'll just get rid of that. Okay, so your positive predictive value. What is a positive predictive value? This time we go across in the column. Okay, so a positive predictive value is your true positives divided by your true positives plus your false positives. Okay. And what is the definition of a positive predictive value? It is the percent of positive tests that are truly positive. Because it's looking at your true positive divided by your total positive rate. In other words, this is really your test for false positives. Okay, and your negative predictive value is going to be your true negative divided by the total number of negatives. And again, what does this translate into? Well, it's the percentage of negative tests that are negative. Put another way, this is your false negative rate. Okay. Your sensitivity and specificity, while those numbers are more commonly reported in the literature, are not your true positive, are not your false positive and your false negative rate. That's sensitivity and specificity. It's the ability to pick up a disease in the population, or ability to screen out a disease in the population. Whereas this is what percentage of the tests are erroneous. And again, a little bit more valuable of a statistic, I think, under many circumstances. So I know this was kind of just a quick biostatistical thing, but I hope it answered some questions for you. Again, I'm Dr. Kevin Windisch. If we can be of assistance here, please feel free to give us a call. We'll be happy to see your child the same day or schedule a rotation for you with your university. Please remember that these videos are not in lieu of doctor's visits. I hope this has been helpful in elucidating some of the major statistics that we use all the time that I see commonly confused among students and colleagues who think they're looking at false and positive, or false negative rates and false positive rates, when really they're looking at sensitivity and specificity in a population. And realize that the positive and negative predictive values aren't always so easy to find because they're not as widely reported, mostly because people misunderstand them. Perhaps next time I'll give a discussion of p-values, but we're going to save that for a discussion of another time. If you have any requests for videos, please leave them below, and look forward to seeing you next time.